Hey practice members, it's Dr. Dave with your Monday video, and today I wanted to go over just a couple things with shoulder. I thought, we haven't done any shoulder videos, so I'd like to just, do a little bit of a tutorial on what we look for with good shoulder health. So the first thing we're going to look for is just glide of the shoulders, and we can assess glide downward, posterior, anterior, across the chest, or in abduction like that. Another thing we can check on the shoulder is, do we have adequate amount of circumduction or rotation in the shoulder joint? So if you look here, my right shoulder can move posterior and anterior in this direction. However, my left shoulder, I actually have a left shoulder injury. So this is gonna be limited and it's gonna cause my face to wince a little bit right there. So I wanna address that. I wanna adjust that area. I wanna address those tissues, that joint capsule. I want to protect it and I want to strengthen it as well. Another thing that we can do for the shoulder is a yoga move called the downward dog. If you're not familiar with that, let me know when you come in and I'll show you how to do that. And then like I mentioned earlier, strengthening your shoulder. We're going to pick things up. We're working as a chiropractor. I'm adjusting patients all day long, so I need to strengthen my shoulders. And if you need some specific strengthening shoulder exercises based on what you do for work, let me know this week and we'll go over a few of those. They can be really simple. We can use some resistance bands, we can use some weights. And then another important thing is, probably one of the most important things, is to adjust the joints around the shoulder. Those are going to include your clavicle joint, your AC joint, your sternoclavicular joint here. If these are out of alignment, the shoulder is going to be whacked. Also the scapulothoracic, where that shoulder blade meets that thoracic spine, if that isn't moving properly, our shoulder is going to be compromised. And then lastly, the thoracic spine, if that middle back isn't moving properly, it's going to compromise function and movement of that shoulder as well. And then another thing that we can do as well is just to inspect the shoulder. So you might want to have your spouse, a family member, a friend, just kind of take a look at your shoulders and see if there's a difference from left to right. If one of them is elevated, if one of them looks swollen, if one of them might look atrophied or a little smaller, and that can be really important to know what's going on with the shoulders as well. So one more thing, tonight, Monday night, we're teaching a class on sleep here in the office, and that's gonna be at 5 o'clock in Spanish and 5:30 in English. It's completely free, so please join us for that. We still have a few seats left, and that'll be here in our office. In the meantime, let's finish off this August strong and healthy and move into September with a great attitude and a healthy spine. I'll talk to you soon.